Yeah, welcome to my channel. The topic of discussion today is clinical manifestations and laboratory diagnosis of typhoid fever. Typhoid fever is a communicable, life-threatening disease, very common in the tropical countries where sanitation is very poor. Let's look at the causative agent or the aetiologic agent of typhoid fever. Typhoid fever is caused by a bacterium known as Salmonella enterica serotype typhi or Salmonella enterica serovar typhi, abbreviated as Salmonella typhi. You observe that the name of the serovar serotype typhi is not italicized, and it doesn't start with a small letter because it is not a species name. It's internationally accepted that the name of Salmonella enterica serotype or serovar type should be written this way. And we'll look at the pathogenesis of typhoid fever. Pathogenesis, that is the disease process. Salmonella typhi is known to infect humans exclusively. So it's introduced into the body from fecally contaminated water or food. So when this bacterium gets into the small intestine, it has to find its way of beginning the process of infecting the epithelial cells, as well as establishing itself, establishing infection and causing disease. So in vitro studies have shown that Salmonella species use invasins, which are special proteins that are used to gain entry into epithelial cells of the small intestine. This is normally achieved by a process known as bacteria-mediated endocytosis involving Salmonella pathogenicity island, SPI1. Previous video on phagocytosis will show how microorganisms are phagocytosed, and also another video on the how pathogenic bacteria evade human immune system will show how invasins help Salmonella to gain entry into epithelial cells. In this process, eventually the epithelial cell brush border is damaged. Following the entry of the Salmonella typhi into the epithelial cells, they are enclosed in membrane-bound vesicle. At the point of entry, it creates what is called a splash effect, or which is known as membrane ruffling. There are links at the end of this slides to show that will give you further reading on membrane ruffling by Salmonella species. The surface of the epithelial cell becomes normal after the bacterium has been internalized. Finally, cytoskeletal rearrangement of the actin molecules occur. Let's quickly look at the clinical manifestations of typhoid fever. Usually, an incubation period of a week is required before the appearance of the symptoms of typhoid fever. Typhoid fever can also have an incubation period between 10 to 14 days. Salmonella typhi causes typhoid fever exclusively in humans, And the symptoms are persistent high fever, headache, diarrhea, muscle pain, chills, abdominal pains, constipation, anorexia, and hepatosplenomegaly. What is hepatosplenomegaly? That is enlargement of the liver and the spleen. In untreated cases, complications can occur following the perforation of the intestine, and these complications include delirium, confusion, and convulsions. Most of the untreated cases in developing countries are usually caused by the infected person or patient not going to consult his doctor on time. And before you know, the unimaginable happens. Person dies from complications of this disease. Laboratory diagnosis of typhoid fever. First of all, let's look at the clinical specimens that should be collected. This includes blood, stool, urine, and serum. These are needed for the primary isolation of Salmonella typhi. To have this specimen, particularly blood, is collected for culture in the first week and is pre-enriched using using special pre-enrichment culture medium such as selenite F broth or tetrathionate broth base. This will be followed by inoculation on selective media such as deoxycholate Agar, CA, or bismuth sulfide Agar. Stool and urine culture can be done in the second week, while serum or Weder test is done in the second and third week. Following the isolation, the primary isolation of the suspected Salmonella typhi organisms, a pure culture is required, which is done by transferring or inoculating fresh medium before biochemical identification of this organism is done. The biochemical tests include 1, motility test. A tube of the motility medium is required, which is a semi-solid medium that is inoculated with the pure culture of the suspected organism, and the tube is incubated at 35 degrees Celsius for 24 hours. Salmonella typhi is motile, so it's able to, a positive reaction is indicated by the organism moving away from the line of inoculation. The next biochemical test is Indole test. The culture media required must contain tryptophan, amino acid, which can be enzymatically broken down by the organism to pyruvic acid and indole, and it's the indole that is detected using COVAX reagent. Following incubation of the inoculated culture medium at 37 degrees Celsius for 24 to 48 hours, 0.5 ml of COVAX reagent is added. A positive test is usually indicated by the appearance of a red color or a ring in the surface reagent layer above the broth within 1 minute. The third biochemical test to be conducted is the Lysine decarboxylase test. The pure culture of the suspected Salmonella typhi is inoculated into a tube of lysine decarboxylate broth or Agar slant of the same medium. Either the broth is used, the liquid medium, or the solidified medium, the Agar form, having a slant or a slope. The tube is incubated at 37 degrees Celsius for 48 hours. A positive reaction is indicated by a deep coloration of the medium. The fourth test is observing reaction in Kligler ion Agar medium. The Kligler ion Agar medium contains 3 carbohydrates or 3 sugars, and the fermentation by the test organism is observed. Typical reaction for Salmonella typhi is alkaline reaction over acid reaction. The alkaline reaction is indicated by the red color of the slope and the yellow coloration of the butt. That is at the bottom of the tube of the medium indicates an acid reaction. Evidence of hydrogen sulfide production by a darkening of the medium. Then if there are cracks in the medium, it is observed that gas has been produced. Culture medium method is the gold standard for laboratory diagnosis of typhoid fever. For example, the specificity of stool culture is 91.5% when you compare it to that of weather test, which is 18.3%. The sensitivity is 31.3% for culture method, and has 29% positive predictive value. The weather test is simply a serological test involving the use of the patient's serum to detect O and H antigens of Salmonella typhi. An antibody titer 1 in 80 for anti-O antibody and higher titer 1 in 160 for anti-H antibody is indicated. Specificity of weather test is 18.3%, which is far below that of the stool culture method, and 81.5% sensitivity and has low predictive value. The typhoid rapid IgM test is a simple serological test to help to detect IgM. The presence of IgM in a patient's serum indicates a recent infection. Thank you for listening.